In South Africa, everyone has the constitutional right to healthcare, but poor infrastructure continues to undermine the quality of care for many. To discuss the potential solutions to this challenge, we're joined by Dr. Aslam Dasoo from the Progressive Health Forum. Doc, thank you so much for your time and welcome to the South African Morning. Just your reaction, especially as someone who is advocating for progressive health, your reaction to the Office of the Health Standards actually finding that over 60% of the infrastructure at South Africa's hospitals don't actually, go with the legislation on how health facilities are supposed to be operating and how they're supposed to be, managed.
Sure. Good morning. Thank you. Yes, I think it's a very important point to begin with. And I think the Ombuds report of a couple of years ago, which went beyond just the hospital infrastructure, showed that 95% of them are, inadequate in terms of all of the necessary parameters. So in terms of infrastructure, certainly 60% and above, that's in trouble. And, I'm interested that the MRC's report, the Medical Research Council's latest 2024 report, touches on two major areas around healthcare, and we can talk about that. But clearly, the Ombuds report is a sobering one, and it just shows the scale of what has to be done, but what has not been happening in the last 30 years.
Yeah, but you see, the thing is, Dr. Dasoo, what's confusing for some of us, and I mean, I don't know if you can probably just give government advice, is that this is not the first time the health ombuds and that office have released reports, and it's never looked rosy.